Good evening. My name is Amy Dayries. I'm a dentist in Roswell, Georgia, and we are in a webinar series all about how you can solve your sleep problems for better health. And tonight's topic is on the relationship between inflammation, exercise, and sleep, and what can you do about that. And we're going to precede this video, tonight's video, with another video about certain supplements that you can take or foods you can eat to help control your inflammation, and then suggestions about exercise as well. But tonight is all about the why. Why does sleep and why is it affected by exercise and inflammation? So without further ado, I'm going to go ahead and share my PowerPoint presentation on sleep's relationship to inflammation and exercise. And here we go. We're going to keep the webinar, we're going to try to keep it to about 30 minutes with a little Q&A at the end of this time. So let me explain how I got into this too. As a dentist, of course, I'm treating the mouth, the head and the neck, but of course mostly the mouth. And what we know is that there is a connection between the oral health of the patient and the systemic or overall health of the body. So because the mouth is part of the gut, it's sharing 50% of the bacteria that's throughout the rest of the gut, especially the colon. And we know nowadays that the microbiome is something that for about every one human cell, there are about 10 bacteria cells. And in the last probably roughly 70 to 80 years, we have had an approach towards medicine and towards bacteria that we want to get rid of a lot of the bacteria in our body. When there's an infection, we try to, I'm going to use the word nuke, we try to get rid of all the bacteria, nucleate them with antibiotics. And we're really rapidly reaching a time when we don't have antibiotics at our disposal. We don't have any new antibiotics in the developmental pipeline. And so more and more, we're going to need to be having discussions about how to live in balance with the bacteria. And so we know the mouth is part of the gut, that the gut microbiome, the type of bacteria living inside you, and your lifestyle, we're seeing with medical research that sets the stage of health for you in your life. And so if you can get a hold of your gut inflammation, you can oftentimes diminish the effects of inflammation on creating disease processes in your body. And when we have disease processes, this becomes sort of a chicken or the egg. They will typically also disrupt your sleep in various ways that we'll get into with our discussion tonight. And in the medical community, when you have certain lifestyle factors, they are referred to as syndrome X. And if you have sleep apnea with syndrome X, then they call that syndrome Z. So we'll be talking about what those things mean and how do you know if you have syndrome X or are developing these types of tendencies, and then what to do about that. Because the whole goal here is I want to empower the public to be able to solve their sleep for better health. And once you try these things at home, you can also then go to your dentist or your medical provider and talk to them about, all right, I've tried this and I've tried that. So now what do I do? And you will need guidance on a personal level. But what I'm trying to provide here for you are just some good suggestions based on what medical research is showing here in 2019. A lot of this will also be elaborated on in my upcoming book called Solve Your Sleep for Better Health. Get to the core of your snore. So tonight we're going to talk about these specific disease processes: cardiovascular disease, diabetes, kidney disease, osteoporosis, Parkinson's disease, and depression, and how these are related or what they will do to your sleep. And I mentioned that we would be talking about the so-called syndrome X. And syndrome X is also called metabolic syndrome by the medical community. And it is when you have any of these three situations here in the middle. You have abdominal obesity rather than thigh obesity. You look more like an apple in your figure than a pear. You might have elevated blood fat levels, triglycerides, and those often will precede diabetes and then develop into diabetes or into high cholesterol types of situations, high blood pressure types of situations. You might have low HDL, also known as good cholesterol levels. HDL is a type of a scavenger cholesterol molecule, and they will help clean out the little bits of cholesterol, the lower density lipoproteins, LDLs, so you have a better ratio of cholesterol in your bloodstream. So HDLs are scavengers. When you have low HDL levels, as is measured by a blood particle type of test, that's a concern that you're going towards having metabolic syndrome. Also, if you have elevated fasting blood sugar levels and elevated blood pressure, and I mentioned just a second ago that what medical research is showing is that oftentimes the blood sugar levels start to become out of order, and then the blood fat levels become out of order, and then you start manifesting diseases. And these things kind of have warning signs for a number of years in most people before they actually come on as full-on diabetes or full-on high blood pressure. And even if you've had these diagnoses, you can self-empower. You can learn through diet and exercise to really help curb these processes and how extreme or severe they affect you, and therefore also how they will affect your sleep. So, but what we know is if genetically you get lucky, it's a little bit luckier to be a pear-shaped figure than an apple-shaped figure. It just seems to be that the people that store more of this visceral or belly body fat here, they tend towards developing problems a little bit more quickly. And to some degree, this is more found in certain populations, Asian populations, for example, than the pear, but anyone can be an apple or a pear. You can also have something called sarcopenic fat, which is also known as skinny fat, where you may look like you're very skinny, but the blood test will show that you have high blood sugar levels or low HDLs and high LDLs, these blood fat composites that aren't looking so good. And so even if you're not actually overweight, you probably want to have a blood test done every 2 to 3 years at the minimum, just so you sort of know where you stand on these numbers. Because those are your canaries in the coal mine. That if you know those numbers, then you can really start getting a lasso over what to do and how to stay healthy. So when we start having these types of lifestyle or blood sugar developments, we start having increased inflammation. And in the dental office, a lot of times you'll start seeing gingivitis or gum disease. A lot of times you'll see that these people also are not getting the daily exercise in on a regular basis, because exercise is going to help curb this inflammation. It gives you a rush of other types of chemicals like endorphins, and those help to blot out. It's not that you don't have the inflammation from some of these other things, but a lot of times things are about proportion. And when you have good, a lot of times the good can start to outweigh the less healthy types of chemicals in the blood. So, but when you have these factors, you are predisposed to heart disease, diabetes, kidney disease, Parkinson's, osteoporosis, depression, these other types of inflammatory types of issues, and autoimmune diseases as well. And actually, so I have on here, one of the good numbers to know about is if you're a man, you want your waistline to be below 40 inches, and for a woman, under 35. But we talked about skinny fat. It's not necessarily how skinny your waistline is. That's just a telltale sign of something, but it's not the end all be all. Knowing what your blood numbers are is actually a lot better information to go on. So, as I said, when you have syndrome X or metabolic syndrome conditions, they can spin off into what they call syndrome Z, which is when you also have a sleep diagnosis. And so I want to talk about how do you start developing this syndrome X going into syndrome Z, and how do you start having this inflammation. And a lot of times in our modern lifestyle, it has to do with diet, and specifically the way that we these days have in our agricultural developments for since like World War II, we grow a lot of genetically modified organisms. We have our wheat, corn, and dairy products. And these are the wheat and corn and the soy as well. They are laden with a lot of pesticides like glyphosate. And the plant has been treated with this, and it's been grown with some glyphosate in it. So when you spray the glyphosate on the crop, it doesn't kill that crop. It kills the weeds around the crop, but you are what you eat. So now you ingest that, and now you actually have glyphosate as part of your intestinal lining, which continues to kill off different other organisms. And it's seeming to cause an imbalance of the types of bacteria that can live in the gut. And so you start with this cycle, you start having inflammation in the gut lining. This little description up here is showing how the cells in the small intestines, where a lot of your digestive processes or chemicals or vitamins and nutrients are being absorbed into the bloodstream, these cells have what they call tight junctions. And when you have this autoimmune issue, the tight junctions begin to break down, and they don't hold the door closed to things that are not supposed to get in. So when you have somebody that has leaky gut, they start having digestive issues, IBS, irritable bowel syndrome. Some of them can go on to develop other more severe digestive issues, even like Crohn's disease, which seems to have a genetic component to it. And there's some specific dietary tests that are done to diagnose like celiac or Crohn's disease. But the tight junctions of the gut start to break down, and then you get other things in the bloodstream introduced besides just the nutrients that were intended. You get lipopolysaccharides, little parts of the bacteria that are in the gut start becoming part of the bloodstream and circulate throughout the body. You have then an immune response by your body to say, this isn't right. It starts to bring in an inflammatory response by your white blood cells. So the composition of the blood ends up changing. Your GI tract, your digestive system continues to be upset because now things are revving up with immune system responses. And if it goes on for long enough, you start to have an autoimmune disease issue. And actually in the medical world, we are looking more and more at cardiovascular disease as actually an autoimmune condition. And cardiovascular disease is our #1 killer as we age. Cancer is another killer as we age. Let's go forward, excuse me. So we know that genetically modified crops are an issue. Also the intake of sugar and alcohol. One of the things I've been frustrated with in years past is sometimes people don't look at alcohol as actually a sugar source. But if you've ever been a baker of bread, you might have heard of friendship bread, and you end up with a little starter, so to speak, from your neighbor with friendship bread. And it's basically sugared fruit or fruit that has fermented. It's got some alcohol content and it's very sugary. And so the yeast, when you go to make your quick bread, the yeast love that sugar source, that sugar substrate from the fruit. Alcohol is fruit that's fermented. It's wine, it's beer, and it's full of sugar. So be wary that, aware that sugar and alcohol content and the frequency of that use can also contribute to this breaking down of this tight junctions in the gut. 20% of the American population these days have IBS types of symptoms. And they'll come in and ask me for nutrition advice, and a lot of times maybe they're just enjoying their beer that they've had for years and years. So if you're experiencing IBS symptoms, I really do recommend that you cut out your alcohol intake on a regular basis. Maybe you go more pure with your alcohol content. Maybe you go for vodka instead of your beer that would be made from like genetically modified wheat. Or maybe you go with a craft beer that's going to use an organic type of wheat. Other chemicals that we think we commonly take and may not attach a lot of consequence to would be taking ibuprofen or antibiotics when we've been ill. Those contribute both to leaky gut, and in the case of antibiotics, it can actually take up to 10 years after a 10-day round of antibiotic exposure to rebuild all the different diversity of the microbiome. It's kind of like if you have Mount St. Helen explode, it takes many years for the trees and the foliage and the fauna to come back and start to thrive after it's been obliterated by hot lava. So we're doing that when we're exposing ourselves to antibiotics, and if we take ibuprofen regularly, because it's absorbed through the gut. So processed foods are very common in the American diet. Sometimes people in the nutrition industry refer to the American diet as the SAD diet, the standard American diet, that often contain these very popular foods: wheat and corn and soy-based products. And dairy, if your cows eat wheat or corn that is genetically modified, they will in turn have a change in their microbiome and in the consistency of the meat. We know that the meat from corn and wheat-fed genetically modified cattle is actually going to have a much higher fatty content than a grass-fed type of beef, which is why you have a spinoff of grass-fed meats as a big buzz term in the industry, and you're going to pay more for that as well. So these things contribute not only to obesity when you eat fattier meats, you eat a lot of sugar, alcohol, but they also contribute to breakdown of the gut. And then you get a different type of bacteria living inside you than you used to have. And what we're seeing over the last number of decades is an incredible rise of these types of autoimmune issues: asthma, multiple sclerosis, Crohn's disease, and type 1 diabetes. And that is, we're asking, why is that? We're seeing that there's a tremendous number of chemicals that these crops are being exposed to that we're eating. So there's a lot of environmental reasons that you may more easily contract diabetes or develop we don't really contract it, you develop diabetes than you would have years ago. With rheumatoid arthritis and gum disease, we're seeing that the type of bacteria that live inside you seem to play a role in whether or not you develop rheumatoid arthritis. And that's from bacteria we're finding in the mouth. But remember, half the bacteria in the mouth is also in the colon. And here's another slide showing the relationship between the diagnoses of celiac, which is a blood diagnosis test for intestinal problems, and the amount of glyphosate that's being used on our wheat here in the United States. So a huge increase in celiac as we've used these chemicals on our wheat. So it cringes me, actually. That's part of why I got into all of this too. I was seeing such an insurgence of patients having digestive issues and not having this awareness. I grew up in the 70s and we had the food pyramid. We're on the base of the food pyramid. What was on the base? Oh, it was bread products. So that's made from wheat. And so we were taught to teach and eat a lot of bread on the base of our food pyramid, and really the dietary models of what is going to probably work well for you in our current society with the current agriculture as it is going to be quite different than the 1970s food pyramid. In terms of heart disease and oral bacteria, well, a couple of signs, first of all, I wanted to mention about what are some early signs of heart disease if you're just looking at somebody's face. And one sign would be if you have a little indentation on your ear where there's kind of a crease in your earlobe. That would be a sign of possible heart disease. And something else is called xerolasma. I have a hard time saying that word. And it's when you get these yellow sort of bubbly sort of pockets of fat deposits about right here around your eye orbit. That's another sign of a heart disease condition developing. But in a test that was done in the last 10 years or so up in Scandinavia, they did autopsies on people that had suffered from heart attacks, and they found that about 75% of those people who had died of heart attacks had bacteria in their heart walls that were associated with tooth decay. And only certain bacteria cause tooth decay, by the way. And these same people had 16 more times oral bacteria circulating in the bloodstream than your average person would. And also 35% of those people had bacteria that were specifically associated with gum disease. So what we're seeing is when you have inflammation anywhere in the body, it's circulating everywhere and really carrying with it lots of disease processes. So this study concluded that maybe as much as half of heart attacks are triggered by a mouth infection. In terms of in the United States, we are at about 9.4% of our current population who has diabetes. And they're estimating that in the next 10 years, we may be more up to like 20% of our population who has a diagnosis of diabetes, blood sugar levels. And we know that there's a strong correlation with diabetes and high blood pressure. So if I can promote this awareness and then we get to some solutions, I think not only will you live better, you're going to sleep better, but you're going to just have a much more full life. And I'm hoping that some of you out there won't have to end up on medicines for forever and ever for these disease processes. In this slide, we're seeing a prevalence of diabetes in the United States with your genetically modified corn and soy here. And we're seeing, as we use these chemicals more and more, we're seeing increased percentages of diabetes here in the United States. We also, with diabetes, have noticed that in the states with the highest number of prescriptions for antibiotics being written and used, we're seeing higher rates of diabetes. And that seems to be because we're killing off the microbiome. It takes years to reestablish it, like I was likening it to like when Mount St. Helens erupted back in the early 1980s. And it's changing how we process our food. The bacteria in your body help you digest your food, and they actually help you absorb different vitamins, as we'll cover in another webinar that's specifically on vitamins coming up in a couple of weeks. But when it's being suggested to you that you take an antibiotic, let's make sure that there's really nothing else you could be doing for that antibiotic, because it's going to have overall health implications. So as you see these darker colors, the darker colors on either the left or the right, the left side is the obesity, the right side are the trends in written prescriptions for antibiotics. But we're seeing a correlation not just with obesity, but diabetes, metabolic syndrome, syndrome Z, syndrome X, and syndrome Z when we're writing these antibiotics. And another contributing factor that maybe people might not have heard of before is called the nitric oxide pathway. In dentistry, we use nitrous oxide, which is laughing gas, but this is something different. This is the nitric oxide pathway. It has 7 main functions for your overall health. And among those 7 functions, they're very critical, actually. One of the things the nitric oxide pathway does is it creates appropriate cell death. So if you have cancer cells developing, you want those to die off and your healthy cells to sustain. So that's one of the things nitric oxide pathway does, is create appropriate cell apoptosis, or cell death when the cells are supposed to die off. It also creates a turnover in the endothelial linings of your blood vessels. That's a fancy bunch of words. What it means is it helps to turn over the cells that line your blood vessels. So if you tend towards hardened artery atherosclerosis, it helps rejuvenate that tissue so that it keeps you working younger. And there's also kids that have like pandas. They are measuring that they have lower amounts of nitric oxide in their maxillary sinuses. So how did I get into nitric oxide? As a dentist, what goes on in the mouth is going to contribute at least 25% of your ability to make nitric oxide throughout the body on a regular basis. Nitric oxide's in air, it's a gas, and you have to constantly generate it in order to have a supply of it. You can't store air. But where you have a little bit of it would be in your maxillary sinuses. And the way that we even make it is it starts in the mouth. When we ingest vegetables that contain nitrites, like green leafy vegetables like spinach, beets are another very excellent source of being able to create nitric oxide. When we eat these types of vegetables, we convert those in the mouth from nitrates to nitrates. What does that? Well, it's actually the bacteria in the mouth that enable your body to do that. And so what that means from a dental standpoint is I want to question the use of regular and repeated mouthwashes. The more antibacterial your mouthwash is that you might choose to pick up on a regular basis, you're actually greatly hurting your ability to create nitric oxide. Another concern about making nitric oxide in the body is if you routinely use H2 blockers, like Tagamet or Prevacid, the purple pill, these types of pills that enable you, if you have GERD or acid reflux, to digest your food more comfortably. And my suggestion to you is that you might read the book that's called The Acid Watcher's Diet. It's by Dr. Jonathan Aviv. He's a gastroenterologist. Excellent read on how to decrease the acid burdens in your diet, which will actually decrease your incidence of GERD or acid reflux. Also, by the way, acid reflux is connected to sleep apnea, which we'll get into here in a few more minutes. GERD is. But a lot of these things are related and overlap and kind of messy. And you need to kind of think about these things as a chicken or the egg situation. But the nitric oxide pathway is something you'll probably see in more other places. This may be, I find it's a lot of people's first introduction to it. But I do not recommend mouthwash use on a regular basis. I understand if you've got a hot date or you've just had a ton of garlic rolls and you want to be intimate with someone, but you don't want to kill your body's ability to make nitric oxide. For somebody with autoimmune issues like Sjogren's syndrome, which is when you have a lesser ability to generate saliva, this pathway is even more important because some of the nitric oxide gets recirculated back into your parotid glands, these salivary glands located on either side of your jaw. And for somebody who's got dry mouth, which means they're more likely to have cavities, they want to be extra especially careful with the mouthwash products that they choose. So here's a study. Duke University was one of the players in this study where they tested things from using water to rinse the mouth with up to a prescription level mouthwash. And it was found that the nitric oxide capabilities that you had to make it would be impeded by at least 6 hours or up to about 6 hours after using a mouthwash. So epidemic of diabetes. I mentioned earlier we have about 9.4% of the population who currently has diabetes, and we expect more of them to happen over the coming years with our diet being the way it is, the way we produce our food. And those people have higher medical expenditures. And wouldn't it be great to save people some money and have a better life while we're at it? We know that those people oftentimes have gum disease problems. And we know that genes actually only play, they say, about a 10% impact on whether or not you will personally develop diabetes. I think we used to believe it was a much greater impact if your ancestors had diabetes, but we are seeing that it's actually what is living inside you that's causing the problem, or what is not living inside you, and your current lifestyle habits. And the American Diabetes Association is showing that the type of bacteria that live inside you are going to directly influence how you absorb your food, how you're going to store fats and sugars. If you eat a lot of sugars and fats, alcohol, it's going to change who is living inside you in terms of the bacteria. It's going to create that leaky gut, which is going to lead to an increase in the lipopolysaccharides that are absorbed, or these bacteria particles, parts of bacteria, or toxins from the bacteria, which is going to create an immune response, which is going to cause these disorders, including eventually sleep issues. And kidney disease is also found highly correlated to diabetes, and 36% of people with diabetes have severe kidney disease, and a lot of those patients don't even know that they have diabetes because they haven't been to the doctor. They just know they're having kidney troubles. So really would like to help people turn this around. This doesn't have to be your future. And this is just sort of a slide to summarize all these connections we've been talking about. As a dentist, I'm concerned about gum disease, but we see that it causes this overall body inflammation with the heart, the gut. The liver has impact. It's working so much harder when it's got a lot of exposure to fats or alcohol. And if you're expecting a baby, it's going to impact the fetus and develop more towards low birth weight babies. And what we're seeing is this relationship with these problems with sleep apnea. We're going to talk about osteoporosis very briefly in a minute, but I was going to point out that if you have somebody that also grew up with the standard American diet, the softer type of diet, think of like hamburgers and hot dogs and things, they may not have grown up chewing so much. They grew up on Gerber baby food. No offense to Gerber baby food. But when you don't use your jaws, your biggest jaw growth happens between the ages of 2 and 4. And without that stimulation of the jaw muscles by heavy chewing, a lot of us end up with dental crowding. Some of us may be tongue-tied. We may have a tongue thrust because we didn't develop here, so then we start posturing ourselves forward. We have our ear in front of our shoulder, and we don't form our face like we did in older times when we ate harder foods. You'll actually a lot of them see on these people a crooked nose because the maxilla has never developed, and we see a more receding sort of chin. And then in some cases, to straighten the teeth, some orthodontists are still pulling permanent teeth to then pull everything back to get things where they look straight, but then we're actually squeezing together, constricting the airway and contributing to a sleep apnea issue. So a lot of these people will have these facial issues, the narrow nose, a high palate, crooked teeth, and they also are often diagnosed with high blood pressure. They're eating these sugary diets and they're having these health issues. And for every inch forward that your head is in front of, that your ear is in front of your shoulder, your body thinks that your head weighs so many more pounds. So right here, when it's directly over, your head may feel like it weighs 12 pounds, but then for every few inches in front of your ear or shoulder that your ear is, it could weigh more like 32 to 42 pounds. And then you start developing this Dowager's hump, this sort of hunchback sort of look. And this can be worked through with some people. It would probably take an opening up of the airway and also seeing a posturalist or some physical therapy to help stretch and open up and develop muscles that haven't had a chance to develop in the past. So again, I mentioned earlier, maybe at least once, maybe twice, that a lot of times these things are like a chicken or the egg kind of issue. So with osteoporosis, we generally see correlation as the body breaks down, the spine breaks down, and that head is coming forward. As you see a lot of times with curvature of the spine, with disc degeneration, those people start having sleep issues. So did they have sleep issues ever before they had the osteoporosis, or did they one contributed to the other? Research is still trying to figure that part out. We come up with more and more diagnoses of different types of problems every year and ways to measure these things. But we definitely are seeing a correlation between osteoporosis and sleep troubles. Same thing with Parkinson's disease. We also have seen studies done with the glyphosate, with the genetically modified foods, the chemical exposure to these types of weed killers, and an onset or a higher incidence of people that have Parkinson's disease. Parkinson's was really not something that you saw very often at all 50 years ago. And now we're seeing more and more people, throngs of people and younger people developing Parkinson's disease. And I personally, I think a way that I like in Parkinson's disease is if you have sprayed a bug with some bug killer, it's going to have trouble moving. And I feel on some level, well, we know Parkinson's is a neurological issue. Some people debate that it might have to do with an imbalance with the serotonin and dopamine regulation. It's like that balance between those two chemicals has gotten broken. What we do see is people that have Parkinson's disease have fragmented sleep. A lot of them have sleep apnea. And they also, because they're not sleeping well at night, then they also have daytime sleepiness. There's oftentimes issues with constipation as well with your Parkinson's patients. And what do we have in our constipation medicine? We put magnesium in constipation medicine. And we need magnesium to have a bowel movement, but magnesium is also a muscle relaxer, and it also helps keep calcium in your bones. So I think if we, as we do more medical research, I'm thinking we may find some correlations also with specific vitamins to Parkinson's. There is some of that that's already been published, but I believe we'll see more and more of that as information comes out. But and then there's a difference too between Parkinson's disease and Parkinsonian symptoms, which can be similar with shakes, but a lot of times too, in the dental world, there are different appliances that can be used to open up the bite. One is called the Gelb appliance, Gelb, after Dr. Gelb, and it helps to open up the airway by separating the posterior teeth a little bit. And then we also have depression and sleep, a correlation with depression and sleep. 90% of depressed people report sleep issues. And we also know that with the SAD, the standard American diet, that there are higher levels in the bloodstream of interleukin 6, interleukin 1, 2, and 6, and also C-reactive protein, CRP. And in the people that suffer from depression, they have higher levels specifically of the IL-6 and the CRP. So there again, we know that what you eat is going to affect the type of bacteria in your body. The type of bacteria in your body actually will indirectly, or some people might argue directly, influence your thoughts, because they are responsible for how we're going to process and what we're going to process and how we're going to store our food and how we absorb vitamins, and if we even can absorb vitamins. So there has been a study published that shows a very high incidence of people having chronic insomnia, really even for years before the onset of a full-on clinical depression. And the average depression episode lasts for about 3 years when it's a major depressive disorder type of problem. So it would be really nice to be able to help people prevent ever getting there. Oral sleep apnea, again, this is sort of another recap summary slide. When you have fragmented or sleep that's not good sleep, it's going to contribute to the development of inflammatory chemicals in the bloodstream. Interleukin 6, tumor necrosis factor, so you will also see a correlation with higher rates of cancer. C-reactive proteins, adipokines, and leptin. Certain foods also have leptin, high amounts of leptin, like peanuts. And this is going to contribute to a patient developing insulin resistance, which is going to set them up for higher rates of obesity and diabetes. And therefore also, a lot of times after they've had diabetes for a while, then they end up with hypertension. These blood sugar levels create also an imbalance of the fat levels, the HDLs, the LDLs, and people end up with heart disease and these just general chronic inflammatory types of issues. And when these inflammation issues are happening, your sympathetic nervous system is revved up. And that also contributes to not being able to sleep so well. You're always in this like fight or flight mode on a low grade level. So these are just common daytime complaints related to oral sleep apnea. Just being exhausted, being irritable, feeling depressed or anxious, having a little bit of acid reflux or GERD, morning headaches, high blood pressure, and for kids, ADHD, ADD, bedwetting at night, and that anterior open bite. This is a bite relationship with teeth we never even had documented in textbooks 50 years ago in dentistry. So this is sort of a newer phenomenon that we're seeing, and we believe is evidence of the types of diets that we eat now that we didn't eat on a regular basis decades back. So what's new in the medical world to help with inflammation? We are going to be doing next week's webinar on a lot of the supplements that you can take that have been researched and the specific amounts and dosages for that. But one of the newest ones, which may be able to be found through your provider using a compounding pharmacy. Let me back up a second. A compounding pharmacy is where you go to a pharmacist who is actually making the prescriptions that he or she is filling. So there's this explosive amount of research coming out right now on peptides. And peptides were heavily researched by the Russians in the 1960s and 70s. They had some different mishaps regarding nuclear energy, regarding their submarine program. And so they studied peptides to help those people heal from some of the accidents that had occurred. And what is now being understood about the peptides research that was done back then, and there's new applications. So there's one called BPC 157, and this can be made into like a toothpaste or a cream and rubbed on, for instance, sore joints to help treat arthritis. In this particular study, I've got flashed up here, they tied ligatures or like basically like dental floss to 2 different groups of teeth in rats. And in the group of the rats that had exposure to this peptide, that again can be applied in a toothpaste, it's more expensive than your average over-the-counter toothpaste, but it was found that those rats didn't develop gum disease, and the rats that didn't have access to the BPC 157 did develop gum disease within a couple of weeks. So in my area, I'm seeing some of the doctors using BPC 157 for acute types of issues with joints, and beginning to be able to use it for more longstanding chronic inflammatory issues. So we'll touch on this more next week in our webinar, but in summary, this is probably a very important slide that you might want to take a screenshot of, and it goes over just what today's numbers are when we're talking about health, the picture of health. What blood level numbers might you have to have good looking cholesterol, good levels of high density lipoproteins, the scavenger type of good cholesterol, HDLs, and the LDLs, you want it less than a certain amount, less than 900 particles per milligrams per deciliter, which is the blood, the measurement in the blood. And then people also ought to be aware out there that in the last few years, the medical community has lowered what they now diagnose as high blood pressure, because we're seeing that revving up. When you start having the high blood sugar levels or the blood pressure, those escalate into worse and worse sleep and health problems that all just go together, that chicken or the egg. So they have now lowered your high blood pressure from, used to be high blood pressure was if you had either number over 120 over 90, but now it's 110 over 80. So we're going to talk about some strategies with supplements and diet in our next webinar. I did say we were going to talk about exercise, and I just want to say if you're exercising, you're going to have a release of a whole other bunch of chemicals that help reduce or sort of downplay the influence of the inflammation types of chemicals. So these chemicals slow the aging process, reduce inflammation, and they make the brain feel good, lowers that risk of depression, which also can lead to a lesser sedentary type of lifestyle, helps you keep your weight off, and it improves your posture, so you won't have that forward posturing and on the road to developing sleep apnea through a forward posturing and a flaccidness in the tissue. So next week's topic, we're going to be doing these webinars on Tuesday nights at 7:30 p.m. Eastern Standard Time, and we will be airing these soon on the Whole Healing Dental website, where they'll be offered as a bundle where people can watch them. But next week's topic is going to be on controlling inflammation through supplements and diet. So again, sleep webinars on Tuesdays is at 7:30 Eastern Standard Time. And we're going to conclude now so we can have a little Q&A session live on this Zoom webinar. And thank you so much for listening tonight. If you would like to reach out and be added to our email list so you get notifications about the webinars, please contact me. Just go to amy@wholehealingdental.com and send me an email. I'd be happy to add you to our list. Thank you so much for watching, and I look forward to seeing you all next week. So take care.